The Morecambe Bay investigation was set up in 2012 in response to some extremely serious quality failings within the Trust. The report was produced in 2015, but even in advance of the report, it became aware that we had failed the public and we needed to make some significant changes in the Trust to improve the quality of our services, not just in maternity, but right across the whole workings of the organisation.
There is a great deal for other organisations to learn from what's happened here, from the legacy of the lives lost, because we had so many things wrong as an organisation.
I think through the years covered by the Kirkup report, we lost the trust of the public, and we are working now very hard to rebuild that trust. And part of that is engaging at all stages in the development of our services with the public, with the users of our services, and with people who've used the services in the past. So they're part of our governance structures, they're part of our project teams, and they work with us and our regulators to feed back as to how services are developing.
The care I received with my second baby was very good. I felt very supported, very cared for, and would say that it was a positive birth, which was a good experience, because I'd been very, very concerned about having another baby after my first baby.
Thank you for all the contributions that you've made, the ideas that you've given us and the suggestions you've made.
Where we develop guidelines now, we have service users on our guideline group that help us to do that. They've also helped us to write job descriptions for key roles for midwives and consultant obstetricians. They've even shortlisted the candidates in respect of those posts, and they've sat on interview panels and been part of focus groups as part of that recruitment process. In amongst all of that, they've also been very much part of the quality assurance visits that we undertake throughout the services, specifically something called 15 Steps, which is about how a woman and her family can ascertain within the first 15 steps of walking into our services what kind of care they're going to receive. So it's been really important to get their feedback.
I've been involved in quite a few things. The biggest part really was the Kirkup Implementation Committee, where we went over policies, rewrote policies, job descriptions. There is no greater way of showing somebody and proving that that things are changing and things are different than being there and watching the trust grow and move forward.
Working with some of the families who we've harmed in the past has probably been the single most humbling experience of my career, and their ability to help us to move on has been quite inspiring.
So I think one of the principles that we've learnt through the last 5 years is co-design is really important. So we were really clear when we received the recommendation from Kirkup for the new maternity unit here at Barrow, that the community needed to be involved in developing that maternity unit so that we could be absolutely certain that it met their needs and their wishes alongside that of our frontline staff.
And we've incorporated that thinking into our designs. We've had architects and estates workers working directly with users of the service to plan the structure and the design of the new services so that they better reflect the aspirations of the public.
They've asked us about everything that we wanted to see in a new maternity unit, and all the things that were really important to us as families that had been through what we'd been through. That was all taken into account and we were listened to, and what they came back with was more than we could ever have hoped for, to be totally honest with you. The input they've taken from the families as well as the wider community with the engagement has been it's our maternity unit. It's not the hospital's maternity. It's like they've given ownership, back to the people, to the community.
I think this was an enormous change programme. It affected the lives of hundreds of people within the organisation, and really this work couldn't have been achieved without the hard work and commitment of individuals, not just from the maternity service, from obstetrics and gynecology and midwifery, but also from other related specialties like paediatrics and anaesthetics, who have made a fantastic contribution to the future configuration of services.
Oh, good girl. There we go.
One of the biggest things that's happened, I think, and has been championed by a chief executive is the listening into action, which really puts the change and improvement at the heart of everything we do at a local level. And the changes are led by our frontline teams, and as executive directors we sponsor those changes in order to ensure that if there are any boundaries or barriers to improvement, we help to remove them.
Having heard what I've heard, if you know that someone is listening to the concerns that you have, people will just keep on bringing them forwards all the time. And so much now, the way the systems are, that ideas for whether it's saving money or providing better care or doing research, it all comes from the people on the ground, because everyone knows the people who do the job day to day are the best ones to come up with ideas. And definitely now, those ideas are listened to further up.
So what we see in all the forms of feedback that we get from women is that their patient experience and their experience in our services is improving all the time, and that their clinical outcomes are improving too. But what's really important is that we recognise that we still have areas of improvement. We will always strive to improve further. Even when we are getting it right in some areas.
It's beautiful. Hello.
I think the services are now unrecognisable from a period 5 years ago, but we haven't finished yet. This is only part the way along the road. So in 5 years' time we will have even better services here at Morecambe Bay.